Candidates for this surgery include people with arthritis of the hip joint who have significant pain and inability to perform normal job or recreational activities. Has your doctor recommended hip replacement for you? Total hip replacement sounds scary, but it's actually one of the most successful orthopedic surgery procedures for relieving pain and improving your quality of life. In this procedure, the surgeon replaces the upper end of the thigh bone with a metal ball and resurfaces the hip socket in the pelvic bone with a metal shell and plastic liner. Candidates for this surgery include people with arthritis of the hip joint who have significant pain and inability to perform normal job or recreational activities. Traditionally, surgeons preferred to wait until patients were at least past middle age to perform this surgery because hip replacements only last 10 to 15 years. However, recently, thinking has shifted in the medical community. More doctors are offering hip replacements to patients with significant arthritis, pain, and dysfunction, even if they're in their 40s and 50s. And earlier surgery can preserve those patients' ability to stay active, which is good for their overall health. If you think you may be a candidate for hip replacement, check with your doctor.